Hey everybody, welcome to Mentoring Minutes. It's Dr. Lemoyne from the Clinical Pattern Recognition team. I'm here with Jeff, and today we're going to pretend Jeff is a 75-year-old male that had his hip replaced a while ago. So, with total hip replacements, the primary reason patients are getting them is for pain relief. Makes sense, right? So a lot of goals are met as soon as they have their surgery. Their pain feels better already, especially after the first month or two. They feel better because pain's better. However, our job as PTs is to make sure they regain their strength, their range, and primarily their function. And what studies showing is we could be a little bit better at that. Even after discharge from PT and going through a course of PT, patients are still showing about 20% less strength compared to the other side and compared to controls that didn't have surgery at 1 year out. But what does that mean? It means that if we don't have enough strength here, we're stressing things in other places in our body, or we're just not doing as much as we want to be or should be. Because studies show now that at that 1 year out, there's a significant increase in low back pain in patients that had total hip replacement when they didn't have low back pain prior to that, compared to controls. What's interesting is they also found that those that had total hip replacement had significantly more low back pain compared to those that had total knee replacement. So it's not just having surgery on the leg, it's actually specifically about the hip. So some of the studies say that during gait, even at a year out, patients still exhibit this ipsilateral truncaling every time they load that hip. Well, that makes sense. If every time I take a step I'm side bending, that's adding stress to the spine. The other thing they talked about was patients feel very uncomfortable just standing on that one leg. At 1 year out, there's still a big asymmetrical difference in when they stand, especially in single limb stance. So we want to make sure before we're discharging our patients that they feel comfortable standing on one leg for up to 10 seconds. There's a study that they published that PTs and patients can't really tell between a 60-40 difference. He may say it looks 50-50, feels 50-50. We may look at him and say, you know what, he looks like he's landing and loading pretty equally. But if we put him on force plates, really the best we can actually see and tell is 60-40. So we want to make sure we do a lot of things in single limb stance to maintain their ability to hold that position comfortably. Thanks again, and we'll see you guys next time.
Clinical pattern recognition apps. We're turning clinicians into experts the easy way.